Hello everyone, I am Susanna Conti from Rome, Italy, Center for Statistical and Social Studies, formerly Research Director in Epidemiology and Biostatistics at the National Institute of Health, Istituto Superiore di Sanità. I am presenting an Italian nationwide study of hospitalization aimed to analyze pathologies affecting drug users, in particular cannabis users. Studies on the health consequences related to the use of illegal drugs such as amphetamines, cannabis, cocaine, and opioids are still few and mostly focused on mortality risks and injecting user risks. Literature concerning the burden of diseases caused just by substance abuse is poor. Moreover, the studies have been carried on mainly analyzing particular subgroups of people, such as patients accessing to emergency rooms. A strong point of the present study is that it has been conducted using exhaustive, official, and nationwide collected data regarding Italian hospital discharges, including both demographic and clinical data. These data have been analyzed to identify the pathologies most related to the use of illegal drugs, with a particular focus on cannabis. Spoiler, the hospitalization profile of cannabis users is fairly similar to that of general population. Our data source is the National Hospitalization Database. This database collects data regarding all patients discharged from any Italian hospital after an urgent or planned diagnostic or interventional admission. For each patient, demographic data such as gender, date, place of birth, as well as discharge diagnosis, the primary and up to 5 secondary diagnoses are recorded. These diagnoses are codified according to the WHO International Classification of Diseases 9th Revision Clinical Modification, the so-called ICD-9-CM. It is interesting to notice that in our database it's possible to take into consideration not only the hospitalization but also the hospitalized persons. In our studies, cases are the patients diagnosed with selected codes that will be presented in the following slide, reported as primary or secondary diagnosis in the discharge forms. The study period 16 years, 2006-2022. Incident cases are patients diagnosed with at least one of the selected ICD codes in their first hospitalization occurred during the study period. To avoid the inclusion of prevalent cases, a washout period 2001-2005 was used. For each comorbidity, the standardized hospitalization ratio SHR, as well as its 95% confidence interval, were calculated using the indirect standardization method, considering the hospitalized Italian population stratified by gender as a reference. We also calculated the sex ratio. In these two tables are presented the ICD codes of investigated drugs and pathologies. Drugs are cannabis, opioid, cocaine, amphetamine, other, including alcohol abuse. Comorbidities are infectious diseases, malignant neoplasm, diseases of the circulatory, respiratory, digestive, and urinary systems. These two pie charts show that drug-related hospitalization are a small proportion of hospitalization for all causes, and cannabis-related hospitalization are a very small proportion of hospitalization for all drugs. This table presents the statistically significant SHR for people hospitalized for different drug use. We see many excesses of risks for alcohol abuse, for cocaine, for opioid, but no excesses for cannabis users are observed. Cannabis users are a small amount of patients during the study period, less than 12,000, and the temporal trend of these cannabis users is increasing both among male and females. The sex ratio of hospitalization for cannabis use is decreasing during the study period. In conclusion, recently many countries in Europe have legalized recreational cannabis use for non-minors, including Germany, after Luxembourg and Malta. One of the main reasons was also related to the social health consequences of cannabis use, scientifically evaluated in several papers, of which the main authors are David Nutt and Jan van Amsterdam, who ranked different substances precisely according to social health consequences. Cannabis always shows a lower score than other substances and even legal substances, particularly alcohol. All the works on which the study are based are particular works on specific groups. No work is based on a dataset of the whole population or of a whole country as this one for the Italian population. This analysis of comorbidities showing health consequences for cannabis users similar to substance users is a key scientific step that opens the way for much further studies. Nonetheless, it must also be remembered that cannabis in Italy is illegal, thus not controlled for quality, and this can cause health harms from possible pesticide and other things, but they do not turn out to be significant compared to no use. I thank you very much indeed for your kind attention.